So what's going on, sweet girl?
I can't breathe that well and I don't feel good.
Did you just come from PE? You did? Before the stock inhaler program, it was kind of a little scary because we would have students that were diagnosed asthmatics, and even though you try to reach out to the parents and call and try to obtain inhalers, sometimes they're having financial difficulties and they might not be able to provide an inhaler to the school and have one at home. So if there was a student experiencing respiratory distress, it was really just, okay, I guess we just call 911 because we didn't have any other option. We have 406 students. It's mostly a mix of Hispanic and Caucasian, and it's only one nurse to 406 students. Okay, we're gonna use your chamber, if that really helps. Make sure you get all of that good medicine deep inside of your lungs. Yes, so we have about 10 diagnosed asthmatics, and then we have students that kind of fall in this gray area of, okay, they sometimes have asthma during the cold season, or they have seasonal allergies, so they need inhalers during that time. So we have a lot of students like that, and it's kind of that way around the diocese as well that I've noticed in other schools. So I get here at 8 o'clock in the morning, and some days it starts right at 8. So we have, especially right now with the allergy season, we have a lot of kiddos experiencing congestion, watery, sneezy, all that kind of stuff. So, and then other schools, they don't even have a nurse, so they have more of a health aide. And sometimes that person can be wearing all sorts of different hats. So they can be the front office staff, but they're also the health person. They are also in charge of scholarships. So it can get pretty intense.
Well, there are a lot of triggers for asthma: cigarette smoke, allergens. A lot of people that have allergies also have asthma, so any type of allergen can be a trigger for asthma. Perfumes, here in Arizona, dust is a major problem, as well as ozone. So when we have very poor air quality days, this affects people with asthma. And then exercise is a common trigger among kids. So when they're active, their asthma gets worse. And finally, respiratory infections. So many of us will get a cold and we'll get sick, but the child with asthma will get a cold and then they'll get an asthma exacerbation and may end up in the emergency room or the hospital. So it's very significant for them.
The times that I've used the inhaler, the stock inhaler, is mostly when I know that the student doesn't have their own inhaler, but they're experiencing respiratory distress. So we had a student last year who came in, and he was just really pale and lethargic looking. And I have a pulse oximeter that reads the SpO2 levels, and he was down to, I want to say, like 79, and that's really, really poor. You know, the norm is between 95 and 100%. And so I called the mom, I let her know, hey, I'm gonna use the inhaler. And we did the protocol, and he just responded immediately to it. I didn't have to call 911. I felt confident that, you know, his SATs were going up to 98%. I had him in the office for a while, just monitoring him. And it just felt good to help this kiddo right then and there. So that's, you know, an example of when I've used the inhaler.
Asthma is an important problem here in Arizona. About 1 in 10 children have asthma, and in any given year, about half of those are going to experience a severe asthma attack, with 1 in 10 needing to be seen in the emergency department, about 1 in 100 being hospitalized. These attacks come on suddenly and without warning, and they're a real crisis both for the child and the school. And if the child doesn't have an albuterol inhaler with them, then it can delay care and lead to unnecessary emergency department visits and hospitalizations. Only about a third or less of children actually have a personal inhaler with them while at school.
Okay, can you shake this? Show her how you shake it. We know that children with asthma sometimes have unexpected exacerbations. And so to be able to intervene with that, even if we don't have medicine specifically for them, in the school, we can interrupt that immediately and then get them to the care that they need.
My student that comes to have his inhaler every single day. Sometimes we'll get really choked up and he'll be wheezing and he'll tell me I can't breathe. You know, I tell him go get some water, take a deep breath, and then I usually call Margaret, the health assistant, and she'll come check him out or have him come here. Because yeah, sometimes he'll just cough, and sometimes he has to even go home because he's getting so sick. He's been in my classroom for 2 years, and at least 3 times since I've known him, he's been in the hospital.
I was approached by the Sunnyside School District. So Dr. Jody Disney, she said, I have a program that I want to implement in my school and I need your help. So when she told me that she wanted to do a stock inhaler, I was very excited because I've worked with schools for the past 20 years, and one of the most common problems in schools is that children don't have their rescue inhaler when they need it. So every child should have a rescue inhaler if they have symptoms. This is the medication that opens up, that relaxes the muscles and allows them to breathe. And so we were able to test out the program. We saw reductions in 911 calls and EMS transports just in the single year that we had introduced it. And so that was really kind of what got the ball rolling, and what made us get started was that this district was so forward thinking in terms of what they wanted to do with health. And after that, Tucson Unified School District contacted me and said, we don't have a nurse in every school, but can we think about how to do this? And so we were able to use some of the nurse delegation laws to implement it in Tucson. And from there, we realized some of the strengths and weaknesses of the program as it existed, and started studying laws that had been introduced in other states, and realized that we needed legislation as well. And then we got very lucky that we already had a stock EpiPen law here in Arizona. So Joanna contacted Representative Carter, who is the chair of the House Health Committee, and she was the one that had put forward the stock EpiPen, and she was willing to sponsor our legislation. So she helped us through the process, and myself and Dr. Joe Gerald went and testified. The Arizona Asthma Coalition, Barbara Burkholder testified. We had several people from school districts come and testify. And I had a lot of fun this year because I got to personally implement it. I'm the co-president of the band boosters for Catalina Foothills High School, and we have the largest band in the state. And so we implemented the stock inhaler for our band because we are often out on the field. We travel around the state.
Imagine trying to get 250 teenagers prepared for a performance in a small amount of time.
There's 250 to 300 teenagers. Things slip through the cracks, and the things that tend to slip through the cracks are the things that they don't need right away all the time, like their inhalers.
So we do have a medical kit that will go to all the performances, and before the stock inhaler program existed, there wouldn't be that medication in the kit. That didn't exist until the program became available recently.
Another thing that's been so helpful in having the stock inhaler is being able to take it with me wherever I go, wherever the student population is. So for example, every Friday morning I go to Mass across the street at St. Peter and Paul Catholic Church with the students. And so instead of having to take this whole bag of each individual asthmatic's inhaler or EpiPen, I can just take one inhaler and my 2 EpiPens across the street with me. So in case anybody did, experience respiratory distress or any sort of allergic reaction, I would just have them right there at my disposal.
Before the legislation was available, if a child experienced an acute respiratory attack in the school setting and they didn't have their personal inhaler, if the attack worsened, school personnel had no choice but to activate the EMS system and call 911, who would arrive and evaluate the child. They may have a stock albuterol with them on their cart. If not, the child may have to be transported to the hospital. And so both the transportation event is expensive as well as the care in the emergency department. And so the typical transportation costs about $500 to get a child from the school to the ED, and an ED event runs around $1,500. And so that's a lot of expense that could potentially be avoided in some circumstances if an albuterol inhaler had been available at the time of the attack.
On our little campus of 600 children, we have 68 known asthmatic students on our campus. So what we're going to do is shake it. You're always going to want to shake it first. And you can open it. Yeah, so the mine dust is big here, being close to the mines, and we have the pecan orchards, which who knew, but that's a huge trigger for both our children with anaphylaxis and asthma. And just seasonal, you know, it's windy a lot, so you have a lot of wind and children are out. Of course, children want to play all day, and that exacerbates their asthma too. You know, kind of give it 1 or 2 puffs to make sure that it's working order, okay? Last year, so this is my first year at Continental last year, I had 6 911 calls. 3 were respiratory distress. I believe 2 out of the 3 students were known asthmatics, and they just either didn't have an inhaler here or forgot it at home. So we ended up having to call 911, and all 3 of the students were treated here. The paramedics treated them here with albuterol. I believe 1 student was taken to the emergency room, and the other 2 were taken home with parents to a physician's office. But it's really scary to be a nurse and to not have anything you can use on a student with asthma. It is heart-stopping. So the albuterol program that we started this year is phenomenal. We have had 0 911 calls due to respiratory distress.
911 calls were reduced by about 20%, and EMS transports were reduced by about 40%. And so that's a pretty substantial reduction in high-cost events, considering that the stock inhaler for the school cost about $40 for the inhaler, along with disposable mouthpieces, $3 to $4 each. And so for a fairly small upfront cost of less than $100 per school, we can prevent costly healthcare events that are down the road.
So here at the Continental Health Office, we have, if a student comes in with respiratory distress, we have our protocol up on our walls for quick access. But we have everything. This is sort of our to-go bag that I use. So we have, you know, emergency diabetes supplies in here. We have our stock epinephrine in here, and of course our stock albuterol in here. So we have the spacers that have been provided to us, and we also have our protocol in here as well. So if I had to go to a classroom or if I had to go to the track, we would have that accessible. So that's on us at all times. And this would be something too, if EMS arrived, it's something that they could take a look at.
If an inhaler is available, oftentimes the child can return to the classroom within 30 minutes and doesn't need to be absent, so they can more fully participate in their educational experiences. And so not only do we benefit by having lower costs for asthma care in the community and for the individual patients, but the children are also made better off.
So Edge is actually one of the oldest charter schools in Arizona, and the oldest in Pima County. The smallness is because many of our students have faced some sort of challenge, a social, emotional challenge, academic challenge, and they really need much more structured support in a smaller environment. We're at a charter school. We don't have the capacity for health resources in the same way that you might just experience and see at a district school. I mean, that's pretty common across all charter schools. What's great about it is, and we didn't talk about this yet, was I think the training was so well thought out. It was so thorough in how you should approach your care with the student, and then the binder just completely reflected that as well. Like, the documents in here went right along with the training plans of how to assess the student. And so, you know, you come into it, and if it's a really bad attack, you're kind of in a crisis situation, and you need to take a moment and figure out, how do I approach this and how do I care for the student? And so it was great to have materials that were so well in sync with what the training was and how to meet the students' needs quickly. And now I feel like just efficacy of staff is up. Like, if any of the teaching staff see a student in breathing distress, like, they know to send them to the office and that we have inhalers. So, but everyone is more aware now, and we have a solution that we can immediately deploy. Send them home, like it was, you know, send them home, which is a real loss for the student, because if it's a low-level attack, right, a quick 2-3, you know, use of dosages of the inhaler and 10-15 minutes of rest, and they're ready to go again. And instead, you know, you had to lose an entire day with the student.
So last year when we didn't have the stock inhaler, it would, you know, I would get very worried if this child was crying so hard because he was having a hard time breathing, and if he wouldn't have his inhaler at school, we had to call the parents. What if they don't answer their phone? What if they're not available? And then I just feel very sorry for the child. But, having it available this year just takes some stress away, because I know it's fine. Even if his isn't here, there's something here to help him.
So I think that if you're going to have a school, you need to have teachers, and you need to have a principal, and you need to have pencils, and you need to have paper. So I think that having inhalers as a part of that it should just be a natural thing, because unfortunately we have so many students who have asthma or respiratory issues that has to be just something that we do.
I think, the good thing is all the major structural aspects are in place. All of the training's been created, all of the materials that schools need to do it have been created. The Arizona Asthma Coalition is maintaining all of these materials on their website, so they're easy for schools to access. The main problem is funding, and the funding is for the medication and for the spacers. Again, it's relatively inexpensive in terms of the single inhaler or spacer, but when you look at that statewide, it becomes, something that's difficult for school budgets to manage. So finding the funding for the medication and the spacers over the next couple of years would be fantastic. We're still willing to put in the work and help schools get up and running, and I think schools are willing to do what it takes to get it up and running. It's just having the supplies that they need.
So right now we're covering about 70% of all school children in Pima County with basically what is a volunteer program. It was made possible by legislation, but it also has required us to put together a strong coalition of committed partners here in Pima County. Our goal is to expand the program in future years to cover Maricopa County, where the largest population center in our state is, but also in other more rural counties.
So the Diocese of Tucson is comprised of 25 schools. And so you're not only helping the kids in Pima County, but we have kids in San Carlos, we have kids in Yuma, we have Nogales, Sierra Vista, Douglas. And so just how many people that can impact is just phenomenal.
And we're unbelievably grateful. So the sponsors who helped put this in classrooms, in schools, have made a huge difference to the 7-8 students that I saw in those first 2 months whose families I didn't have to call and say, I have to send your kid home, they're having a really bad asthma attack. We could say, hey, your student came to us and they didn't have an inhaler. We had our school inhaler, and we were able to care for them, and they're doing fine, and they're back in the classroom, but we wanted to let you know that they had this happen today, they forgot their inhaler. Please remind them to bring it, but we've got resources here for them. That call as a parent myself, that feels good to know that can happen in your school.
This year we've used our stock inhaler 5 times. I believe 3 of the students were known asthmatics to us, and again, either where was their inhaler? It was on their bedside table at home. They had forgotten their inhaler. I had one student in whose inhaler had run out, and the parents hadn't been able to get that prescription filled. So those 3 were known asthmatics that we could treat, monitor, and they were good to go back to class. We had 2 other students that we used the inhaler on, and both of them have anaphylaxis, asthma, and eczema. And when I met with the parents earlier in the school year, I said, how's their asthma doing? And the parents all said, oh, their asthma is doing pretty well. And lo and behold, I had 2 of them in here with, I can't breathe. I'm having difficulty breathing, my chest is tight. So we used the program with them as well. And those 2 students, parents of course were called in that case, and they were both taken home or to the physician's office, but again, no need for 911. So the program it's been a godsend. It's been phenomenal.